So, good day everyone. I'm Betty May Hernandez, first year college from DSN 1B. So now I'm going to demonstrate to you the assessing the musculoskeletal system of our patient. First, I'm going to introduce myself to my patient and verify his name. So, good day sir, I'm your student nurse for today. May I ask what is your name? Ilang taon na po kayo? And then, for the next procedure, we need now to explain to our client what we're going to do and why it is necessary. So, sir, for today po, i-assess po natin ang inyong musculoskeletal system for us to know if meron po ba kayong abnormalities, ganun po sa inyong musculoskeletal systems. Okay lang po ba sa inyo yun? Okay. So, for the next procedure, we need now to do the hand hygiene or observe other infection control procedure. So, the rationale of this is to avoid the spreading of microorganisms or the cross-contaminations among patients or clients or vice versa. Okay. So, next, we need to provide for client privacy. For example, we need to close the door or close the curtains. So, the rationale of this is for the patient to be comfortable in the whole procedure that we will be doing. Okay, so next we need to prepare the equipments and the things that we will be needing. First is the goniometer if necessary. Okay, so next we need to assess or ask the patient the following. Okay, so sir, meron po ba kayong any presence of muscle pain? Okay, any limitation po sa movement ninyo? Okay. Do you experience sports injury po ba? Okay. Any loss of functions po? Okay. So, after asking some questions with our patients, now we will proceed in the first procedure in assessing the musculoskeletal system. Okay, so first we need to inspect the muscle for size, compare each muscle on both sides of the body to the same muscle on the other side. So, sir, okay, so the patient has normal body size and both sides are also equal or symmetry. Next, we're going to inspect the muscle on the shoulder. Okay, so I don't see any muscles contractures. Everything is normal and nothing to worry. So next, we need to inspect the muscles for fasciculations and tremors. Okay, so I don't see any abnormalities with our patient, especially I don't see any signs of tremor. Now we will proceed in palpating the muscles to address to determine muscle tonicity. Okay, also we will palpate the muscles while the client is active and passive for placidity, spasticity, and smoothness of movement. Okay, so I palpate the muscle of my patient and I don't, sir, do you feel any pain as I palpate your muscle? Okay, so he don't feel any pain so everything is normal. Also, I don't see any abnormalities with his muscle. Okay, so next we will test the muscle strength. Compare the right side on the left side. So first we will test the sternocleidomastoid mastoid of our patient. Okay, so sir, control mo po. Okay, so next is the trapezius. Okay, so next the deltoid of our patient. Sir, control. Okay, next we will proceed in the biceps and triceps. So sir, control. Okay, so next is the fingers and the wrist muscle strength. So sir, taas niyo po yung kamay niyo. And control niyo. Okay, so then I will continuously test the muscle strength of the hip abduction, the hamstring, and the quadriceps, and the ankle and feet. So sir, pwede po ba kayong humiga? Okay. So sir, pakitaas po yung yung basal. Sa kabila naman po. So next po is pakitaas po ay ilagay po. Okay. So, after that, okay, so sir, pwede na po kayo umupo. Okay, so sir, do you feel any pain as I test your muscles? Okay. So, I do the test with my patient and he didn't feel any pain or he doesn't complain. Also, the muscles is strong and I don't see any fractures or abnormalities. So now we will proceed inspecting and palpating the bones of our patient. So sir, pwede po ba kayong magkuba? Ay, kasi tanggalin ko. So first, we will inspect the skeleton for normal structures or deformities. Okay, so sir, pwede po ba kayong tumayo? So, based on my observations, I don't see any deformities and the structure is normal. So next, we will palpate the bones to locate any edema or tenderness. Okay, so there is no sign of edema or tenderness, so everything is normal with our patient. Okay, so next we will proceed in inspecting and palpating the joints of our patient. First, we will inspect the joints for any swelling. Okay, so I don't see any swelling in the client's joint, is normal. So next is to assess the joints and range of motion. Okay. Okay, so everything is normal. I don't see any abnormalities. The joints range of motion with our patient is normal. Okay. Okay, so sir, pwede na po kayo magdamit. So after all the procedure and assessment, we will document all the relevant data that we've done. Okay, so After all the procedure, we need to do again hand hygiene. Okay. So that's how I demonstrate to you the assessment of the musculoskeletal system with our patient.